One of the most common fears I hear from parents when I talk about introducing AAC is the fear that it will prevent their child from speaking or that their child will use it as a crutch and will never learn to talk. I can totally understand that fear because we live in a society where, as human beings, speech is the most common form of communication. But I want to assure you that AAC will not hinder speech production, will not prevent your child from talking. Research shows that using AAC actually increases verbal speech production, with one study in 2006 showing an 89% increase in verbal speech production with a 0% decrease. That's pretty cool. So if you're still hesitant, I encourage you to talk to your speech therapist about it. Talk about who your child is. You know your child best. Think about how they're communicating with you right now and whether or not you want something that will help bridge the gap between learning how to communicate with their mouth, how to speak with mouth words. Because it might be that AAC will help them share what they need, share what they're thinking, share their feelings, be able to communicate these things that are really hard with their mouth, while in the meantime, it's reducing frustration, it's allowing you to build a connection with your child, and it's increasing their autonomy or their ability to say and do things independently. Because something else I see is over prompting from parents. Lots and lots of prompts to do something, to say something, which is exhausting for the parent and puts a lot of pressure on the child. So think of AAC as a therapeutic tool, a tool we can use while we're working on verbal speech, while we're working on our engagement, while we're modeling language, both verbally and with AAC, as a way for them, your student, your child, to be able to say what they're thinking and what they need.